this disease, or if anyone does.
So one of the things I think make people more fearful is the not knowing whether we're ready to tackle something like this. I know that Johns Hopkins late last year had a list of countries that were ready for this type of situation, and excuse me, the United States was at the top. But are we ready for this particular situation in the United States?
We certainly have a lot of very well-trained professionals, both in and out of public health and even in community hospitals, that know the techniques to manage such an outbreak, but we need the political will in order to get it done. And more than anything else, we need the community to help us by cooperating in our efforts to find every case, do the contact tracing, and isolate any suspected or known case.
Everyone has to
buy into this. Everyone has to be a part of this.
Dr. Marty, the governor of Florida has just declared a public health emergency. We know of at least 2 potential cases in Florida. Perhaps there's a couple more. What does that mean exactly, a public health emergency? What does that mean?
To declare it in Florida is very similar to when it was declared as a global health emergency by WHO. And what it is, it's a legal definition that allows them to release certain resources and to facilitate the movement of trained personnel and equipment and resources in general in order to manage an outbreak.
So that's a good thing.
It's a very good thing, because Governor DeSantis recognizes that we need to do exactly what we've just said, that they need to go to wherever there are cases and do their best to contain it there so it doesn't spread widely throughout the state.
So we're going to go to the questions in a moment, but as you know, and you've been around the media for a long time, media sometimes have the tendency to hype dangers. This is obviously a worldwide danger, and sometimes headlines can be a little misleading, and unfortunately some people only read the headlines and don't get into the granular articles, and there's a lot of anxiety out there. So I just want to read you a couple of headlines and get your take on them. First coronavirus case of unknown origin confirmed in the U.S. What does that mean?
Well, that's a very odd way of stating something that we know, and that is that when we have a person who tests positive who hasn't been to an area where there's an outbreak and who hasn't been in contact with someone who's been to that area or anyone who is known to have the disease, then we consider it a broken chain or a outside of a cluster case.
It's not spontaneous generation. They didn't just...
No. Yeah. They clearly acquired it from someone, or something that they touched that someone contaminated. But, so no, it's not spontaneous.
Okay.
It's a real thing.
Actually, someone asked me that this morning. The CDC is considering expansion of airport health screenings for novel coronavirus. And I know that you did health screenings at ports of entry during the Ebola outbreak in Nigeria. Do those health screenings at the ports of entry help in these situations?
They do, although there's obviously limitations to them, and certainly just taking a fever won't be enough. But as you know, we do questionnaires as well, which are very helpful. And what they can really help with is once we identify a case, we already have the paperwork, the data to help us do that rapid contact tracing and capture all the people, where they are, where they've been, and where they're going, so that we can contain this outbreak.
All right, here's my favorite. Woman catches deadly virus twice. Experts fear it's like anthrax.
Okay, that's a very confusing title,
okay.
Especially since anthrax is a bacterium and
not a
quite
virus.
Different means of transmission. It's not even transmitted person to person. But the headline isn't completely false, because yes, we have documentation of persons who have had symptoms and then stopped having symptoms, were tested once and then again 24 hours later, negative for SARS-V2, the virus that causes COVID-19, but then a few days hence started having weak positive results for the virus again. And what does that mean? Well, we're not sure. What do we have, 9 weeks of learning about this virus? The world is only coming into grips as to the extent of how this particular virus operates. More likely than not, what happens in those individuals is that they possibly had that virus hiding in protected zones of their body,
and then it pops up
and then
again.
it popped back out.
All right, let's take some of the questions from the folks watching online. This is an interesting question, and I'm glad that you're here. Can the virus be spread from a package from overseas or an infected area? Eddie wants to know.
Well, it's almost impossible, but it's not totally impossible. It's very unlikely. The timing of the packaging, the cooling of the entire way in which these packages are handled really reduces the risk enormously.
Do we know how long the virus lasts on a surface, for example?
Well, that's a really good question because very careful studies have been done on similar coronaviruses, and days. So indoors, under the right temperature and conditions, it can last several days. And there's one very carefully done report of a different coronavirus that shows that it can last as much as 9 days indoors. Oh. But it's easy to clean. It's very important. It's easy to clean. Just because it can be on the surface doesn't mean that we can't get rid of it.
Okay, so let's talk about cleaning. You say easy to clean. What do we clean it with?
Oh, my goodness. Standard household cleaning products in general have the right ingredients to clean the surfaces.
So the ones that usually say we take care of 99 or 95% of viruses and germs and bacteria altogether.
Should get rid of it. This is an envelope viruses, and that envelope of the virus is made from our own cells. And those cells are sensitive to high levels of alcohol, like 65, 70% alcohol will clean it off, chlorine, a variety of different cleaning products.
Okay, let's take another question. This one is from Laura. I am ending a bad cold. What happens if you have a cold right now? Would drinking 1,000 milligrams of vitamin C help?
Well, here's what the real question is how can we keep from having dual infections? So a cold is certainly a little bit of vitamin C. It can be a little helpful. You take too much vitamin C and your system is just going to urinate it out because your body has a very tight set point as to how much vitamin C it allows to circulate in your system. So you're mostly throwing away your money buying that extra level of vitamin C that you're going to urinate out. But it doesn't hurt. Mm-hmm. It's not a harmful thing to do. Let's go back to that issue of dual infections. Mm-hmm. That's a concern, and that's one of the reasons that we've been asking people.
By that you mean, like, say I have a cold and then I get the coronavirus.
Yeah.
That would be a dual infection.
Right.
Or you have pneumonia and
you have strep pneumonia and you get the coronavirus, or you get both things at the same time, or the flu, etc. And that's one of the reasons that we've been asking people to vaccinate for these other respiratory pathogens, so that they don't end up with a dual infection.
And there is a flu vaccine, and there is a vaccine for the type of pneumonia you're talking about.
Yeah, for pneumococcal pneumonia, there's actually 2 different vaccines.
Okay. So get vaccinated, people. Okay, Jasmine wants to know, is the virus in Sarasota now?
Well, we know that Sarasota is in one of the counties that we have a suspect case, and by suspect we mean that it was tested locally in Florida and it's positive in Florida, and we're waiting for confirmation from the Center of Disease Control to determine whether it does fit their criteria. And based on what I know about the testing methods that we're using in Florida, which are outstanding, I think Florida is superb. This Department of Health is absolutely on top of things. I think that it's going to very likely prove to be, in fact, positive.
This is a tough one. Elizabeth wants to know, how was the virus created? Did you bring your crystal ball today?
Well, so viruses and bacteria have been on the planet for billions of years, much, much longer than we've been around. And they've been evolving and changing and continue to do so at very fast rates. And we've known about coronaviruses as a family since 1931, when we first identified them in chickens. And in humans in the 1960s, 1965, when we recognized that there were some coronaviruses that caused colds in people and so forth. So, and because they are RNA viruses, in general, they're prone to change a little faster than your DNA viruses, although coronavirus is unique among RNA viruses in that because it's a very large RNA virus, it does have a little potential to do a little proofreading. So it doesn't change as rapidly as other RNA viruses and has other ways of changing. This is a virus, and we know, for example, that there are very, very similar genetically viruses in 2 different species of bats. And we also know that it's the close cousins of COVID-19, SARS and MERS, also originated in bats, but went through a different animal before it came to humans. So in the case of MERS, it went through camels. In the case of SARS, through the civet and through the raccoon dog. What is that intermediate animal that is the link between bats and humans? We don't know.
Don't know yet.
We don't know. And,
And like you said, it's been 9 weeks.
It's been 9 weeks.
Right.
We're doing our best.
I think we probably know a lot, considering, right?
Oh, we know tremendous amount. I mean, the speed of our accession of knowledge and treatment modalities to help people survive is astronomical.
The cadre wants to know, are face masks effective? A lot of people are asking this question.
Yeah.
And a lot of people are already buying masks.
Right, which is, that sort of is, it's a problem because, first of all, in the healthcare community, we need those masks, and we don't need them to be unavailable for dealing with an actual sick patient with any disease, not just with this COVID-19. So we need those masks. That's part of the problem. The second thing is, in general, if you're just wearing a mask and you don't know how to wear it, you might actually be doing yourself more harm than good. Not to mention that if your eyes aren't, if you don't have goggles on that are full wraparound, you can still acquire virus through your eyes.
So it's kind of a false sense of security.
It's a very false sense of security. If anything, it's just a psychological reminder that there's something out there and that you should be cautious. But I think we can do that without putting on a mask, unless you happen to be a high-risk person who's going to be in a setting where you're going to be around people who could potentially be infected. So who's a high-risk person?
People with immune problems or other medical problems.
Well, actually, what we found from all the cases right now is that it's age-related, so that the older you are, the worse your risk is, the higher your risk is. So by the time that you're 80, the risk of mortality from this disease goes up from 2% to 21.8%. So that's really a very...
Which is true for a lot of other viruses, including influenza, right? The older you are, the more vulnerable you tend to be.
Except for influenza and many other viruses, we have the extremes of age, right? Little children and the elderly. But this coronavirus and SARS and MERS seem to spare children, relatively speaking. So people under the age of 18 or 18 and younger have a much lower incidence of disease in general. So of all the cases so far, only about 2.4% have been people 18 or younger.
And the fatalities tend to be older people.
And 97, a little bit over 97% of them have mild to moderate disease. Only about 2.5% are severe, and 0.02% are critical. And those are older children then.
So why do we think that's happening? Why is this virus...
This is part of what we're trying to understand about all these beta coronaviruses. Why is there this big discrepancy between adults and human and
children,
adults and children,
human children,
human children? Yeah, we don't really understand it yet. And one of the problems that we have is we need a serologic test to see whether being positive because by RT-PCR, which means you have the virus, has anything to do with being having a reaction to the virus, or that the virus that you have is active and doing something so that your immune system actually responds. The only place that currently has just produced, I mean really literally in the last couple of days, is China, a serologic test. And they're now starting to do those kinds of tests to try and figure out the answers to some of these questions about the differences between children and adults.
Okay, I think we kind of touched on this already, but Valkyrie wants to know, do flu vaccines help against the coronavirus?
Right, so not directly at all. The flu vaccine is targeted towards things on the surface of the flu virus that are not even present on the surfaces of coronavirus.
So it doesn't work for coronavirus?
It doesn't in any way.
So why is it good, though, if you have your flu shot at the moment?
Two reasons. Number one is so you don't confuse yourself. Right? You don't want to have the flu, for which we have good antivirals and for which we have good treatment methods, with something that's a little more frightening and has, frankly, 20% higher case fatality rate overall. So you don't want to confuse yourself. And number two, the dual infection bit
That you talked about.
that we spoke about before.
Okay, Laura, oh boy, Laura is traveling to Rome in 1 month. What can I do to protect myself while there? She wants to know.
Well, Laura, right now, the U.S. CDC and the Department of State is asking you not to travel to Rome in 1 month. So the reality is that unless you're going for some very critical reason, you probably shouldn't go. On the one hand. On the other hand, as we've already spoken several times, this is a rapidly evolving event, rapidly changing numbers, and we have no certainty of what's going to be going on in Rome 1 month from now, let alone right here.
Is there a feeling that things will probably get worse before they get better, or we just can't answer that question?
It really depends on how we act. It really depends on, first of all, we need to change again our testing criteria. So our testing criteria last week didn't allow for detection of cases that were acquired in the community that weren't connected to travel or contact with someone who was known or suspected. And that by itself hides potential,
leads a lot of people out.
And right now, we improved that. We're now testing people in the community, but our testing criteria remain testing people who are severe or critical. So that 80% of people who have mild or moderate disease fall outside
Falling
of our
through the crack.
Right, and that's terrible because we need to do the containment. And unless you capture those people too, we don't do proper contact tracing.
Best way to prevent disease spreading for those with immunodeficiencies.
Right.
So if you're compromised, if you know that your immune system is already compromised.
So first, let me just tell you a little bit about what we know in terms of the people who are at highest risk. So we already talked about age being a risk, and the older you are, the more serious is, without any other comorbidities, without having any other underlying disease. The cardiovascular disease is actually a higher risk than immunosuppression. So people with any kind of cardiovascular disease or hypertension, those people are very high risk, as are people with diabetes. Those are also people who succumb much more to this COVID-19. Another high-risk group are cancer patients. So those are actually the people that we have seen are more at risk for having severe and critical disease and much more at risk for dying from the disease.
What about people whose respiratory system is compromised, people with chronic asthma, that type of thing, or heavy smokers, for example?
Absolutely. So hang on, I omitted that category, which is
you did it on purpose.
No,
you wanted me to ask you another question.
No, but that's really important, and that's something I've been trying to explain, is that when you smoke, you're damaging the ciliary cells in your respiratory system. So, and those are the cells you need to get rid of this and every other respiratory pathogen. So it's a really good, it's a really good time to quit smoking. And I don't care what you smoke, by the way, it's all true.
So it kind of makes sense that if you've been a long-time smoker, you're probably an adult, you would be at higher risk than children who normally don't smoke.
Absolutely, right? and people who live in very polluted cities are at increased risk.
So China
as well.
is kind of, people in China are kind of stuck, kind kind of stuck in that, right?
They are, and so one of the interesting things about the data from China is that the fatality rate for men is almost twice as high as that for women. And in concert with what you're saying, men in China are big-time smokers, much more so than women. And of course, there is that fact that many Chinese cities for a long time have had significant problems with air pollution.
Well, I just lost my my next questions. Technology is catching up with me, but I think one of the things that we keep seeing people ask is how to protect yourself, because we keep telling them, don't panic, just prepare. So I think we've already spoken about the mask and whether you need it or not. What else can we be doing?
Okay, so first of all, businesses need to prepare, and homes need to prepare, and schools need to prepare for what and how. They need to prepare a plan for if anyone in their family gets sick or their work environment, and how they're going to continue operations with a person that has to be isolated, right? And how many people need to be isolated in their things. So they have to set up protocols. That's really important, because knowing what you're going to do and having a plan makes things a lot smoother whenever anything happens. Schools have to have plans, especially for special needs children in schools. How are we going to maintain some level of education going on throughout our school systems? Those are things that have to be thought out and planned and determined now, when we still have time to do it easily and reasonably. Meanwhile, increase the overall hygiene of your spaces. So that's your work areas, your homes, places that you travel. Go ahead and bring a little wipe with you if you're going to be sitting on an airplane for a while, or on a bus, or any place where you're forced to be within 6 feet of people for longer than 15 minutes. Those are basic things that people can do. The other thing, equally important, is to just maintain their own health as much as possible. What do I mean? I mean, eat sensible food. Eat the right amount of the right nutrients every day.
A lot of this is common sense.
It's common sense.
And you've been actually at this for a long time, telling people you need to wash your hands, for example.
Sure. Oh, and also let's go back to the fist bump.
The fist bump.
Yeah, let's not do handshakes and close contact.
Why?
Because
why are handshakes such a no-no for you?
Because these hands, you don't know where they've been. You don't know what I've been touching, right? Whether I was around other people who are contaminated, and this is the part of your hand that you touch your mucous membranes with at a very frequent rate. So you want to reduce that exposure. And also, let's bear in mind, I do agree with washing your hands, but if you wash your hands a lot, your hands are going to dry out, right? And you're going to have to use lotions to counter that effect, because otherwise you'll have cracks in your hands, and then another source for infections, right? So you want to keep your hands clean, but and one way to do it is to touch fewer things and fewer people.
And if you do wash your hands, and I hope everyone does wash their hands often, you also have to do it properly.
Correct.
Which a lot of people don't even think about this. I mean, you're washing your hands. How difficult can that be? And it's not difficult, but you do need to do it in a specific way that is helpful as opposed to not helpful.
Right. One of the things people often omit is the part about scrubbing their fingernails. Scrubbing their fingernails on their palms to help get virus or bacteria out of where their fingernails are. And I think that's even harder if somebody has long fingernails. It becomes a more of a challenge to get that clean.
Is there an amount of time that you need to wash your hands?
Well, ideally the
effective?
old sing happy birthday, 60
that really
seconds.
works? Happy birthday?
Well, only because it gives you the right amount of time.
And everybody knows how to
sing happy
birthday, right?
I think most people do. But yeah, so attention to each and every digit, scrubbing the fingernails, cleaning the wrists. Those are the basic things that you want to do, and drying the hands properly too. It's not just about the washing. It's did you dry it properly?
Okay, so that brings me to something that I noticed the other day when I was in a bathroom at a store. There are bathrooms you go into which have the paper towels, and then some of them who have which have the dry air machine, right? Is one better than the other?
Well, you're going to be potentially, I'm not a big fan of the air drying methods because many times those are up high, where if there's liquid on your hands, that's getting dispersed, and if your hands happen to be contaminated, some of that contaminant is getting out and temporarily, for a very, very brief amount of time, mind you, being aerosolized. So unless that dryer is way low, where you're not sending that out into the atmosphere, I'm not a big fan of that. People like those because they don't have to clean up the paper mess, right? And some people think that it's better for the environment not to have to use paper, but the reality is you're using electricity. And how is that electricity being generated? I mean, those are not good arguments. So you prefer the old-fashioned
paper
towels? The
old-fashioned
paper is better because not only are you able to actually dry each digit in a good and appropriate way, but also many of us who are a bit germaphobes will go ahead and use use one of those paper towels to open the doors to get out, which is also a preventative method.
Dr. Marty, we have time for one question, and Jose wants to know if we can expect further travel restrictions. What's your opinion?
That's a complicated question because once we start seeing disconnected outbreaks in the United States, and it's very likely that that's going to be happening, as it's already happened in Washington State, and it's already happened in California, and we have cases splattered here and there, it sort of becomes a bit of a moot point about where you're traveling and where it's risky. What's risky then becomes being on a plane or being in any kind of setting where you're going to be close to other people within that 6 feet range for 15 minutes.
So it
or
doesn't
longer.
really matter at some point. It
At
won't
some
matter
point,
where you're going,
unless
but
we're
how
able to
you're getting
contain it. If we are able to truly contain it, then yes, those travel restrictions will increase and become more common.
All right, Dr. Marty, thank you for sharing your expertise. This fascinating conversation. This is a scary topic for a lot of people, and I think having you and your background and expertise explain it to us makes us feel a lot better and certainly a lot better prepared. So thank you for joining us. I have a feeling this is not the last time we're going to be talking about coronavirus. But that is it for us for now. I'm Ileana Varela. For you watching online, thank you for joining us, and I hope you will join us again on the next FIU Insights.